important conversation. So we spent some time this morning talking about next generation doctors and began to explore treating patients within the comforts of their own home. This next session will take an even deeper dive answering the questions, what will it take to bring healthcare into the home? I'd like to welcome to the stage two remarkable speakers, Eduardo Conrado, I just had to roll that R, from Ascension, and Ashish Saxena from Best Buy. Thank you.
Thank you.
Perfect. Thank you. Hello, everybody. Thank you for joining us. We have about 30 minutes and a bunch of things to cover. So the way we have structured these 30 minutes is both of us will share very briefly what our respective organizations are doing in this topic. And then we have a set of questions for each other, so we'll do that conversation, hopefully with the intent that we are able to convey the central thesis that this is a space which needs interesting partnerships. And as you look at all the innovations that you are trying to do, think of us as companies and enterprises very open to conversations. But let me get started. My name is Ashish Saxena. I'm president of Best Buy Health. And let me take a couple of minutes and tell you what Best Buy is trying to do in this topic of bringing healthcare into the home. And to do that well, I thought I'll play a short video, but let me set this thing up. This is a video where you're going to hear a voice which is an actual customer of ours who is a senior who's just recovering in the home after a double lung transplant. And this person is recovering in the home, and Geek Squad, which is one of the largest distributed tech workforces in the country, has gone into the home and has put these tiny sensors all over the home. A sensor in the bed, a sensor in the toilet, a sensor on the refrigerator, a sensor on the chair, and so on and so forth. And this senior, Stanley, who you will hear from in a minute, is living his life and recovering from a fairly significant health moment. And completely forgets about these sensors because these are tiny and they're completely hidden in the system, and the person is living his actual life, except that we are at the other end picking up all this data from all these various sensors, and our AI patterns are recognizing errant behaviors. And when we notice something odd, we then try and engage with that person in ways that the person can interact and then do something else. So let me play this video and I'll come back and recap exactly what is Best Buy trying to do.
Hello.
Hello, this is Liz from Great Call.
I'm glad to receive your call.
Oh, good.
The tech and the touch show up really beautifully in the Lively Home program.
Just checking in. How are you doing? How are you feeling?
I feel great. I feel great.
The Lively Home program works where we put sensors that are passively monitoring activity in the home of a senior. When changes look alarming, somebody from our company gives them a call.
And have you had any changes in your routine lately? Is your appetite still healthy?
No, it's not healthy.
Okay. What's going on with that?
The sensor on his refrigerator indicated he'd been accessing the refrigerator less often. The sensor data on its own wasn't going to tell anyone what they needed to know. You had to actually talk to this person to find out.
I don't know. Food doesn't taste good. Well, I don't know what it is.
Got it.
I don't know.
And have you seen a doctor about this?
No.
This is how this program works, and this is how we are impacting people's lives and helping them stay well in their home.
How great is it to have a caring member on the other end of the line to help this person through their situation?
The ability of a little piece of technology with someone who cared that came together to get this senior the attention that he needed to live independently at home.
Nothing can replace a live person caring for another person.
So what you saw, if I just quickly recap, what you just saw is what Best Buy is trying to do. What we're trying to do is we're trying to bring in technology into the home and be able to use data and insights and the usage coming from those technologies to be able to provide meaningful service. And if we can connect, as we say, tech and the touch, then we might be able to do something valuable. In this particular instance, Stanley, the senior, when the person called, said, "I'm doing great," as you heard. and yet our systems knew that things were not that great. So that's what Best Buy is trying to do. Dwala.
All right, perfect. Thanks. Ashish, if you don't mind, I'll stand up. I'll cover 3 quick slides. Just as a background, Ascension is the largest nonprofit healthcare system in the US, kind of focus on compassionate care with special focus on people living below poverty or populations that are vulnerable. By the way, the AV system is working. This is just my accent that's coming through. We had Corey from the AV team was kind of like fixing me. I told him, hey, you know what? The thing is actually working. It's just me on it. Which I didn't think Spanish accents were cool till I saw The Mandalorian. And actually, The Mandalorian's from Chile. So that accent that you hear is Spanish. So British accents are about to be passé. Latin American accents are about to become cool. Now, if you think about our mission, why is bringing care to the home important for Ascension? We think it's been driven by changes in our market. There's huge demographic changes happening in the US where the older population on 65 plus is growing. So by 2025, it's going to be sitting at around 18%. Once we hit 2030, it's going to be 21%. And once we hit 2050, it's going to be a quarter of the population. And 50% plus of that population is suffering from one or more chronic diseases, which is huge. Now, we also are seeing the healthcare costs continue to rise on it, especially around medication. And the uptake of value-based care, which we got to get implemented, has been slow, but it's necessary. We're also seeing the consumers' expectations are changing. And that's great, because I think it's been driven by service industries outside of healthcare. So our expectations in terms of ease of access, use of digital tools are being driven by other industries, and I think you'll see faster adoption within the healthcare space. We're also seeing non-traditional players coming into healthcare, which I think will accelerate change, and I think that's good. One of the things that we're seeing, and you see it here in CES, I think tech companies are getting healthcare faster than healthcare is getting tech, which I think will put pressure on the healthcare providers, insurance vendors to adopt tech much faster. Technology is going to play a big role in everything that we do, and I think it's not for technology's sake. I think people are still going to play a huge role on delivery, but availability of data, IoT, connected devices, not only in terms of consumer tech coming into healthcare, but also I think healthcare devices that are specific for chronic disease management being connected will also accelerate a lot of the change. So having said that, our view in terms of seeing home as the next point of care is not with individual point solutions. It's actually going to take a framework that brings all this together. So let me walk you through at the bottom when we're talking about live at home. There's 2 populations that we're trying to address in that end. One of them is people that are looking for convenience, that really don't want to take the time to go to a primary care doctor. There's a whole set of conditions that we can take care through virtual care. And that's the fastest growing segment that we have within Ascension right now, is the virtual care delivery. But as you start going through the 65 plus population, the seniors that want to age at home, not only do we have to provide the healthcare component through virtual, but wraparound services. So that means transportation, food, in some cases, support with handyman, in some cases, support for spiritual care at home. So there's a whole set of wraparound services that keep people living at home longer. Now, addressing the whole set of population that has chronic diseases, we definitely feel that remote patient monitoring and virtual care on that area is going to play a huge role. We have thousands of patients deployed with remote patient monitoring, and we're seeing probably a 10-time gain when somebody has a chronic disease that's unmanaged versus a chronic disease that we can manage remotely through virtual components. The next part of our life is if you have an acute situation that requires a patient to go to an ED, we want to be able to bypass the emergency room and inpatient admittance. So in Tennessee, what we're testing is we feel that 7 to 10% of the population that's coming to an emergency room, we can actually admit them into their own home and do remote patient monitoring, do rounding, and be able to provide the services in their home, which, again, just makes it much easier for the family to be able to support them. And then if we have to admit somebody into an inpatient setting, post-acute care, we can also do that remotely within the house. We're doing that already for total joint replacements, and actually are seeing probably about a 30% gain on improvements on not having people readmitted within a 30-day period. So think about it as a framework. When you think about the home, don't think about point solutions. We have to create a framework that takes different demographics and different points in life that enables us to stay in the home in each of those settings, and it all centers around digital components that enable that and data kind of flowing across the ecosystem. Turn it back to you.
Well, thank you. I actually like the two of us are doing it because we are new to healthcare, except we are inside the home. That's the world we live in. We look at technologies within the home, and your organization looks at the healthcare world, and I think just a unique combination of these sorts of strange bedfellows is perhaps likely to be important. But let me just ask you a question. And I remember when we started in Best Buy, this pursuit of health, which was slightly over a year back, we had this crazy thesis that today if I'm sick, I have to go to a doctor or a hospital or an ER, and that's the last thing I want to do. I'm sick, I want to be at home in the bed, except healthcare does not transact in the home. And we said, that's strange, and especially for seniors who have two chronic conditions, for them to every day get up and get ready and get in the car and go wait and so on. So for us, this was a real problem of society that technology could do that. But why is this healthcare in the home important to you? Like when you look at Essential more broadly, and I know this topic is important to you, but could you share some thoughts on why?
Yeah, I mean, I do think the population in general is opting for a preference in the home, but if you think about the two mission populations that we target, the most vulnerable, which are the elderly population, and then people below poverty line, you got to be able to provide digital means within the home to be able to save time and money. You know, people don't have the time to take off from work or check if they got a condition, so we want to be able to give them a do-it-yourself triage at the home, and if it fits within the condition, put them in a virtual setting as soon as possible. That way you make it convenient and save time. You're addressing the population that's avoiding going to the doctor because they're not sure if they can pay for it or they're not sure if they got the time to take off from work. So that's one area of the population. The other one's the elderly. The elderly population, they're a vulnerable population that don't have the means to transport or to have someone to give them care beyond healthcare. You know, so that's when we said the wraparound services, right? They're looking for transportation, companionship, spiritual support. And I think if we're going to take care of them, within their wellness and beyond the face-to-face that we already have with them, you have to do it at the home. So how do we extend that through either digital or physical means?
Yeah, it's fascinating that how in our career horizon, home is going to become a site of care, which is like, it's profound in many ways. What do you think is holding it back today, if today's times? Like, why is this not happening faster when all of us recognize it's important, especially for seniors, but even generally?
Yeah, a couple of things. I think first, the care models that we have haven't been focused on extending into the home. I think as a provider now, we're switching that mindset. I think the technology is getting there where we'll enable consumer tech and med tech to enable much more remote monitoring from the home. I think data liquidity also is an issue. I mean, in order for this to work, you got to be able to have data kind of flow back and forth between multiple settings, and I think that's getting much better. Healthcare, I came from outside of healthcare, and I used to work in tech before, supporting government, and I thought government was slow as molasses in terms of adopting tech. I think healthcare is kind of like right below forestry in terms of being able to kind of move into the space. So I think as healthcare moves into the cloud, adopts IoT, and then we adopt other modality, I think that will accelerate it. I mean, my comment in terms of tech getting healthcare faster than healthcare getting tech, it's all good, to tell you the truth, because that's been one of the boundaries that's kind of, avoided the speed of kind of going into a home situation.
Yeah. No, I think that makes sense. I can keep grilling you if you're okay with that, or if you want to.
No, let me ask you something, too. You talked about strange bedfellows, and it's kind of unique. Ashish and I have been talking for a year in terms of this home world collapsing. But what do you see in your space in terms from the consumer point of view, on what type of solutions you're seeing, get an uptake in your area?
Sure. I mean, Best Buy fundamentally is a company that brings the best of innovation to the consumers, and we spend an inordinate amount of time and energy looking at all sorts of technology that innovators are building. As we looked at health, I think there's something really good and there's something really troubling. What is really good is the amount of innovation happening. There are lots of interesting tools and technologies that are getting built. Several of those are ahead of the demand, but that's okay, because that can be explained. The market can be created. What, however, is more troubling is that most of these solutions don't necessarily have a robust service layer around them. So, for example, if you know my weight and what's happening, and I'm seeing my weight every day and seeing, oh my God, it's not going down, what exactly do I do next? Is the question that our customers keep trying to figure out, which is, how do we go beyond these point solutions to a more holistic experience? And I think that's the part that we are most working with these innovators, which is, if you have a solution, how can I put a wrapper of service around it? How can I put a wrapper of support around it so that they actually solve rather than just inform? And I think, and the second piece, which we keep seeing, is this odd flow of money in healthcare. Let me just give you a quick example, and don't belabor this point. But I was looking at the world of seniors and caregivers, and we were trialing a solution which was meant for caregivers, like family members as an example, to be able to take care of the seniors. And this was fantastic. We were picking up all this data from the home and helping triage and be able to tell this caregiver, when should you call mom rather than call 3 times a day. And we thought this is brilliant because it was such a helpful tool. And when we went into the market, 2 amazing insights. One was this caregiver said, well, even though it is only $30 a month, I need to make sure that the other siblings are involved in this decision so that we can actually make something happen, because I don't want to take a decision by myself and so on. I said, oh my God, we'll have to get all the family members together before they can even buy a service. And the second was, which was even more frightening, was they said, we were telling that, if you have to send the senior to an assisted care facility, that's expensive. It's several $1,000s a month, and these are tiny solutions. And the whole notion was, however, when a senior moves to the home, we can sell this home, and the cash flow is far more important. So said another way, I think when you start deeply understanding how the consumer mindset needs to evolve to embrace all these new technologies, that's not that simple. And that's really the partnership Best Buy provides, because we stay in the world of consumers, we start to look at these other things.
Hey, let me ask you a question. You talked about siblings trying to define on who pays for what, $50. I think we even got a bigger challenge with the payers, right? On how do we get a lot of these solutions to actually be covered? What are you doing in that space?
One of the most amazing things that people who are innovating in healthcare is that this is one of the strange business problems which is in best interest of everybody. For example, keeping seniors at home longer and more productive and independently using technology is good for the senior. They want to live at home. It's good for caregivers because all the other things are so much more expensive. It's good for payers and insurers because it reduces cost to serve and improves member experience. Same with providers, it prevents readmission and so on. So the good thing here is that we're all working in an area where everybody wants this to actually happen. And to that extent, the insurers have a very important role to play, and I think they are playing. They are engaging with these technology-based solutions and trying to figure out how to embrace that so that these cost to serve can be reduced, the better member experience can be done. So I'm very encouraged by it is, I think, one of the strange business problems where everybody wants it to actually happen. I think it's that extent, it's interesting. As you've been looking at healthcare in the home, I know you've talked to me several times in the past, the need for partnerships and so on. Any perspective on that and any lessons that you have learned? And what will it take to actually get this thing done?
Yeah, I mean, I think as a provider, I don't think any provider out there can enable 100% of what's required to get into the home. So I do think there's partnerships that are going to have to happen. Just an example from our side, I mean, I do think in order to make it happen, we do have to set up the hub to be able to connect all the components of it. But chronic disease management, there's a whole set of companies that are doing very innovative solutions in that space. And, those have to be able to kind of plug in. Companies like yourself that, got retail presence and ability to kind of cover within the home and deployed electronics that are, easy to use, are going to be a requirement. We've been working with Google on how do we normalize the data that even we have and make it easier for the providers to kind of use them. So you can have a blend of big tech, startups, providers kind of changing our approach in terms of how do we build and deploy technology, and then non-healthcare players coming in and creating a unique solution. And it's all about the experience, to tell you the truth. I mean, I think that the thing that we got to avoid, there's a ton of solutions. You walk the floor out here, you all are kind of addressing the space, but we can't deploy 100 point solutions in the space. We got to kind of create a framework that makes it much easier. And then so also, we got to kind of collaborate as an industry, deploying design thinking on it. How do we bring design to create a holistic experience within each of the segments that we're trying to kind of tackle? Because if not, the consumer is going to have a hard time kind of making all this work.
Yeah, and I couldn't agree more. And I think one of the things that we were learning through our own journey over the last year and a half, was that if you look at your life today, there are these health episodes that happen. And when something happens around health, you activate the healthcare system. You suddenly had a flu and you activate the healthcare system, and then something else happens and so on. Except life between these episodes, which is typically led in the home, has a tremendous bearing on your episodic moments, like what in the industry called social determinants of health.
Yeah.
Any thoughts on that? Which is, what is the non-healthcare part? Like everyday, you mentioned, transportation and food delivery and so on. What role can that whole body and what innovation can this group be doing in that space?
No, so that's a great point. So probably a year ago, I started hiring designers and researchers outside of healthcare to come into Ascension. And that's just to kind of flip the view from, kind of deploying healthcare versus taking it from the consumer point of view and, how do we make their life easier? And our head of design came out of IDEO, but he came up with this Mobius, which we were looking at on the right side, how the consumers and the patients interact with us as a healthcare provider and all the friction points that we got to kind of solve. But on the left side was the rest of our life. In the points in time where we were not in one of our sites and actually living at home. And actually, you can't decouple those two. They're connected. And then so we're looking at how does that impact. We shouldn't be looking at improving wellness or health just when somebody comes in and has an episode and is dealing with us. We actually have to deal on the left side of the equation, which is when you're at home, on your everyday life. How can we impact and prevent some other things from happening and just make it easier?
Yeah. I love this Mobius visual, which is how do you connect everyday life in the home and decisions being taken together with the health. And if that can be connected, could be quite powerful. Any message for the group? Because this is a group full of innovators who are looking at all sorts of innovations.
Yeah, you know what? When I talk to my fellow technology leaders and the provider space, I think we're willing to break glass and kind of accelerate change. Honestly, like you said, in terms of being able to bring in more startups and work with other technology companies, I think you're going to see a change in speed across the industry, which is, I think, is going to be good in general. Yeah. And plus, I think you're getting, healthcare providers going into tech and then tech coming into healthcare. So I think it's all good in terms of the direction that we're going.
Yeah, and I couldn't agree more. I think the same is our feeling, which is as healthcare and everyday life are coming together so that people's full continuum of their life is available, and insights can be drawn. Lots of companies need to come together because all of a sudden it's as important to get mom to the doctor, and therefore Lyft should be able to deliver, come at the same time to pick up mom to take to the hospital. It's almost as important as food is delivered in the home when it's needed, as important as meeting the doctor. And I think that this continuum of everyday life and health coming together is pretty powerful. So, my own message to the room is, given that this will require a fabric of companies to come together to have a holistic thing, engage with us. I mean, this is the thing that is hard for any company to do. So it'll be interesting to collaborate on many ways.
This is the way.
Yeah. Well, thank you. At least my own email ID is my first name dot last name at bestbuy.com. I encourage you to reach out to us. We think this problem will take lots of companies to come together to doing it. How wonderful.
Perfect. Thank you.